I think this conference is a big it's really a big conference. It's becoming maybe the biggest conference we have in Europe, but not only. It's not only a European conference, also because there's people coming from all over the world, and it's very important to meet in order to discuss many issues. And the issue of tropical diseases that may expand, it may in some way occur in temperate areas due to climate change is a big issue, because actually we are facing major changes on our Earth. Climate change is one of them, globalization is already a reality, so we need new and innovative tools in order to contrast this kind of emergencies.
So this meeting is really important because it really brings together people from different parts of the world to talk about infectious diseases, and specifically talk about the importance of the development of new antimicrobials to treat resistant bacterial infections. What's really become clear is that without the ability to continue to create novel antibiotics, modern science is going to be in extreme jeopardy. We wouldn't be having dialysis, transplantation, we wouldn't be using immunosuppressants to treat chronic autoimmune diseases if it wasn't for the antibiotics to support infections in those patients. So I really think it's critical that we, as a community of physicians and practitioners who are dedicated to improve global public health, that we understand that we need to really have a voice, a strong voice to talk about. It's really important for people to invest in anti-infectives.
So the one that I'm really looking forward to is about the transcriptomics, so looking for new ways of diagnosing infection in patients, and that's on today, I think.
Yeah, I think my biggest takeaway from ECCMID, I think there are a couple of things. One, the problem of antibiotic resistance is not going away. And I think if anything, we're going to expect to see more issues, including in places like the US. So I think what we need to learn is how we can better identify what the problem pathogens are within our patient populations. And I think we need to come up with some newer paradigms for how we address them. Unfortunately, in many hospitals, it's often a simplistic approach where there are certain antibiotics that may be open for clinicians to use, and they tend to prefer those, when in fact, we probably need to have a broader approach to how we treat these patients and understand that for certain infections within certain hosts, certain drugs or drug combinations at specific dosing may be better approaches than what we've done in the past, where we tend to try to lump everyone together.
I really enjoyed, yesterday we sat and listened to a debate on whether rapid diagnostics has been able to decrease the frequency of antibiotic prescribing, and you can tell that there was a lot of passion from both sides, and both sides presented really good arguments, so it was really fun to watch all the prescribers and non-prescribers kind of get in on it and vote and voice their opinions on it.
One of my favorite things about ECCMID is just the incredible diversity and strength of the science. There have been a lot of really interesting talks. I think right now I'm very interested in the behavioral-based interventions, so interventions that really target behavior change for stewardship providers. I think those are very exciting evidence-based ways to improve prescribing practices, so I've been really excited to see that research.
So I think there have been a huge number of highlights this year at ECCMID. Probably one of the things I'll take away most is just how much progression is being made in the understanding of antimicrobial pharmacokinetics, pharmacodynamics, and just how far we still have to go in terms of being able to truly individualize therapy. But I think the more evidence that emerges, actually the more hopeful you can be that eventually we will find interventions and technologies to be able to really optimize dosing based on individual parameters.
I'm particularly, the clinical metagenomics session was sort of in our wheelhouse as well. I mean, looking at the diagnostics and application of next generation sequencing, meeting that particular application is an exciting field, and hopefully will at least, so I'm not quite sure what the current status is in Europe, but for the US is now just starting to get some sort of traction within application and routine diagnostics. And I think once we can get that through to some sort of regulatory compliance, we'll see that be a much bigger sort of effort. And so that's my other excitement beyond biomarkers. And of course, antimicrobial resistance and everything else is pretty interesting as well.
I think it's the networking. Like there's great science, but it's also wonderful to meet with colleagues, people who you've read the papers of for the last 10 years, and you suddenly see that person in person and get to chat to them, and also meeting new colleagues as well, and hearing about the cutting edge science, and for me, clinical trials that are happening in the Staph aureus bacteremia space, and ideally building collaboration so that we can do investigated, initiated studies into the future.
So I think the unique part about ECCMID is the fact that you have so many different countries, so many different universities from across the world getting together in one site and presenting their research, whether it's bacterial, fungal, parasitic, malaria, and everybody's coming together, right? And basically trying to improve microbiology and infectious disease.